Welcome, everyone, to the second in a series of webinars this year focusing on clinicians. This one is focusing on clinicians leading system-wide environmental stewardship sustainability, sponsored by the National Academy of Medicine. And we're excited today to bring you an exciting panel, and we think it'll be a robust conversation. We invite you to think about your questions that you'd like to ask and put them in the chat. And what we're going to do first, my name is Beth Schenk, and I'm the Chief Environmental Stewardship Officer for Providence, a large health system in the Western United States. And I'm going to get us started with a few opening remarks right now and then hand off to our three panelists who will be introduced in a moment. Then we'll have a discussion with a few questions that we have prepared, and we would also like to take your questions. So please be thinking about those and type those into the chat. So to frame where we are today, healthcare exists, obviously, so that clinical care can be delivered to people in need by clinicians. So for example, in Providence, we have 125,000 caregivers, which is what we call all of our employees, and about 90,000 of them are clinically facing. Most of these are licensed or registered to legally deliver care from physicians, nurses, pharmacists, therapists, aides, techs, and more. And these are the people who understand care delivery and who, when asked, have good ideas for making improvements that might increase efficiency, decrease pollution, and also save money. Major clinical decisions are made by clinicians. Those are the rules, basically, based on state boards of nursing and medicine and pharmacy. Purchasing decisions for clinical equipment and supplies are at some point along the decision chain made by clinicians. Decisions about allocation and prioritization of care are made by clinicians. All of these decision points and many others are fundamental to our efforts today, transforming healthcare to be more environmentally wise. Success in decarbonizing and reducing resource consumption, preparing for climate resilient communities hinges on clinicians. It really does. And yet, many times, clinicians are overly busy, and asking them to get involved in environmental stewardship may be a bridge too far. It just may be too much. Also, like many of us alive today, they may be overwhelmed by our planetary crises. Further, they may not feel empowered in their practice sites to advocate for improvements along these lines. Or they may feel they don't know what to do. On the other hand, thousands of clinicians from all disciplines are diving into the hard work of understanding best practices, measuring improvements, sharing their findings, and advocating for change. And that's what we're here to talk about today. So we're going to hear from three leaders in the field, including two physicians. They have thought long and hard about their roles and how we can engage clinicians more effectively in this work. You can see on this slide who our panelists are. Gary Cohen, President and founder of Health Care Without Harm, Dr. Lisa Patel from the Medical Society Consortium on Climate and Health, and Dr. Paige Fox from Stanford University. I'm excited to hear from them, and we'll hand it off to Gary. Thank you.
Thanks very much, Beth, and welcome everybody to the webinar. I just want to go over quickly what we see some of the key roles for the health sector in addressing the climate crisis. One, as Beth said, is to demonstrate and model the transformation of our society out of our addiction to fossil fuels and toxic chemicals, a recognition that you can't have healthy people on a sick planet, on a planet that is based on fossil fuels and toxic chemicals. So healthcare is 20% of the US economy and can model this transformation. The second role is that we are experiencing all over the country and the world these extreme weather events that have enormous environmental and public health tolls, whether it's hurricanes in western North Carolina or the fires in Los Angeles or so many other disasters. So healthcare needs to be the last building standing, and clinicians need to understand what are those impacts for their patients? What are the impacts of living in polluted areas already? And then you have 100 degrees for 3 weeks. So there's an element of understanding where the vulnerabilities are in the community and anchoring the resilience of those communities. And third is around leadership and leveraging our power to educate people around the links between climate, health, and equity, and to be part of a larger communication campaign for the society to help people understand what's happening to them. Next slide. So the importance, and others will speak to this, but the importance of healthcare as a trusted voice is so powerful and important, especially at this moment, in a time when conspiracy theories, the denigration of science and expertise, and magnified lies have become mainstream. And so having clinicians be able to stand up and speak about this crucial fact that the climate crisis, a reliance on fossil fuels is at bottom a public health crisis. We are the largest share of the hospital workforce, as Beth just described. And a lot of research shows that especially new clinicians who are coming into the field want to address climate change. Next slide. The Commonwealth Fund, New York Foundation, did a study, and they said that 80% of the clinicians they talk to feel that climate change is critical to their hospital's missions. They want to work on this issue and the environmental impact of their system. And 60% feel like that climate policies, their employers' climate policies, impact their decision about whether even to go work for them in the first place. So there's a broad agreement that the climate is actually a crucial environmental determinant of health. The next slide. We have a network, Healthcare with a Harm, as a physician network that is engaged with surgeons and radiologists and OBGYNs. There's media opportunities, there are advocacy opportunities. So we encourage you to join, but the point is whether they join our network or where you join the Medical Society Consortium for Climate and Health or the Alliance of Nurses for a Healthy Environment or certainly the National Academy of Medicine Collaborative, it's absolutely crucial to join with others at this point, because joining with like-minded professionals at this political moment is an antidote to authoritarianism. Because authoritarianism governments thrive by isolating people and removing their agency. And when we join with others, we can increase our agency. Next slide. One of the things that's been really powerful over the last, I would say, 5 years or so, is that the sustainability movement has grown outside of operational people, food service people, architects, facility managers, and now there's 21 systems that have hired medical and clinical directors of sustainability. So it's elevated clinicians as being critical stakeholders in the drive toward more sustainable healthcare. This is a really positive moment, and you'll be hearing from Paige Fox in a little bit about what that looks like at Stanford. So that's shown to me that this movement has grown and expanded across many different medical and clinical disciplines. Next slide. There, in our recognition of where clinicians are engaging around that, it's around a whole set of things, whether it's overuse of plastics, whether it's anesthetic gases, some of which are 2,000 times more potent than carbon dioxide or nitrous oxide. There's a growing power of clinicians as key advocates in a bunch of different arenas around sustainability and climate action. Next slide. Plastics is one of those places. This is a amazing graphic of the waste from one surgical operation. So healthcare is a massive user of plastic, including much of single-use plastics. And as the fossil fuel industry recognizes that our society is going to move toward renewable energy for transportation and for energy generation, they've decided that the place to grow the market is around petrochemicals and plastics to sort of to load the world with more of these toxic materials. And so next slide is an example of that getting health professionals to weigh in at a policy level has significant impact. So we and many others organized clinicians to come to this plastics treaty that's being negotiated by the United Nations Environmental Program. And the demands were, don't give healthcare an exemption from this treaty, which is what the fossil fuel and petrochemical industries were arguing. they need to be given special consideration. But we in healthcare are already trying to get rid of a lot of these toxic plastics, single-use plastics, and that it should be very much a part of the treaty. And the recent negotiations in Korea a couple months ago did not give the industry an exemption. The treaty continues on, but when the treaty started, there was almost no health orientation to this treaty, the health impacts of plastic throughout their life cycle, but now there is, and it's really a reason is that healthcare professionals have shown up and spoken very powerfully. Next to last slide is coming up. So what we also found for clinicians but others who are working on sustainability is that it saves money. So the most recent, we do an awards program at Practice Green Health, and systems sign up to say they're doing various different kind of interventions on sustainability. And this graph shows that just among a few hundred hospital systems, they've saved collectively over $182 million in 1 year. If the whole healthcare sector embraced some of these very actionable measures, we'd be saving tens of billions of dollars. So whatever myth there is about sustainability costing more money, it actually saves money and provides the reason for why there needs to be paid staff doing sustainability work, including clinicians. Next slide. Every year we do a conference, Healthcare with Harm Practice Green Health, that about 800 or 900 people come. And so this next year it's in Atlanta. It's on May 6th to 8th. There's a big clinician crowd that shows up for there. And so we just welcome anybody who's on this call who would love to come. Thanks very much. I'll stop there.
Lisa, please go ahead.
Okay, great. So thanks so much, Gary. And I'm going to give the perspective of being a clinician at a healthcare center, which at the time when I started in the work, we didn't have a net zero goal or a sustainability director. I live in Northern California. I'm also at Stanford with Paige, and we, back even a few years ago, had some really terrible wildfires. And while none of my facilities have had to be evacuated, we've certainly been impacted. So there was a day where there was so much overwhelming smoke outside that you could smell it inside of our NICU. Power was cut off at 9 p.m. one night by PG&E without any notice because it was a high wind event during wildfire season, which is a risk for sparking wildfires. And we were not prepared. We had to just run around our facility with a bunch of laboring moms and moms that had just given birth and figure it out in that moment. And of course, our sky turned orange in 2020. During those years, we were also going through the pandemic. We also were under a political context where climate change was trying to be erased. And at the time, many students and faculty and staff felt really concerned that our healthcare institution was not doing enough on climate change. Next slide, please. So I just want to talk a little bit briefly, and I'll tell you the case example of what we did at Stanford. As you as a clinician are thinking about how you can get your healthcare institution to become a leader in sustainability, there's a tried and true path in terms of what an advocacy roadmap looks like for institutional change. Every one of them will be a little bit different and require some catering to the particular context. But the basic roadmap is figure out your goal and have a big dream goal. The way you get people in to join you in a mission is to think really big, but then also have smaller goals on the way to get there. So for us, our big goal was that we wanted Stanford to commit to a net zero goal. We wanted a proper sustainability program office. But then we came up with a bunch of smaller goals on the way to get there, including a renewable gown project that we worked on with faculty and students. Find your people. And so in terms of, to Gary's point, you will neither last nor be able to get anything substantial done if you go at this work alone. And in fact, there is good data that shows that if you're concerned about the climate crisis and you go about it on your own, it'll actually have a boomerang effect and make you more concerned at the end because you'll feel like you don't have agency or efficacy. So find your people, and I just have two pieces of advice there. One is find your force multipliers. What we found is that there were so many students that were interested in the work, connecting with the students, and the students themselves were the force multipliers that brought more students into the work. And then you have to make the ask, just like Jerry Maguire, like, who's coming with me? You have to be bold, you have to be courageous, and you have to get out there and ask people to join you and give them concrete and achievable things that they can actually do. Next, you find your decision makers, depending on what it is that you're making the ask for, make your direct appeal. And then always this is the case, but particularly in this political context, you try and try again. Next slide, please. So for us, what that looked like, again, this was 2020. We were just at the beginning of the pandemic. In a way, this helped us because we were over Zoom able to get together students, faculty, and staff across UCSF and Stanford. And we planned a symposium. We figured that this was a good way. We didn't want to be confrontational or antagonistic. We wanted to dialogue with our leaders. And we're very fortunate because our leaders at both of our institutions were willing to show up and have that conversation. So we held a CEO roundtable. Gina McCarthy got on with her Bostonian accent and got in the face of our CEOs. And our CEO, David Entwistle, who is just an immensely thoughtful person, came away from that recognizing that Stanford had a lot more work to do in the field of sustainability, and then really starting to move the organization towards doing more in sustainability. So, you know, our goal was achieve net zero. Our people were students and staff, faculty and staff. Our decision makers with the CEOs, and our appeal was the symposium itself. I'm happy to say that 6 years later, Stanford is now on websites like JACO as leaders in sustainability. And that wasn't done just by this. Paige is going to talk next about the work that she's been doing. It took a lot of people and a lot of pressure points, but activities like this one really helped bring a cohesive community together to make the ask. Next slide, please. So that's a little bit about the how to get healthcare sustainability on your consciousness for your leaders. And now I just want to talk a little bit about medical societies. So the Medical Society Consortium on Climate and Health, we bring together now about 60 medical societies. And what we've learned over the last 8 or 9 years is that there are some societies where it's almost like they check the box. They join the society and they don't do anything else. The societies that are really moving forward are the ones where there is internal organizing. And so we at the consortium, we are certainly a place of convening, but now we're trying to turn back and make sure that societies themselves have the infrastructure to be leaders on climate change. Because every specialty needs to be talking to their individual population about how to prepare for climate change. We're past the point about talking about climate change in generalities. We are seeing the impacts of how climate change is affecting every single specialty of medicine, from the ophthalmologist down to the podiatrists. So the big goal for medical societies should be regularly offering CME content at their conferences, board certification materials that they're working with their sister boards on, that is dependent upon their specialty. And then also, each of the societies does play a role in advocacy. And so we'd like to see more government relations staff that is educating and advocating on climate and sustainability policy as a priority issue. The steps to get there, and again, we've watched lots of different societies go through it. A lot of folks that are part of the consortium use the lessons that we teach them to go back to their societies to do this work. If your society doesn't have a resolution on climate change or sustainability, write one up and work to get it passed. If you go to our website, the Medical Society Consortium on Climate and Health, and click on podcasts, we actually just dropped an episode with Dr. Jerry Abraham, who talks about his path on how they were able to get AMA to pass a resolution on climate change. And then work to get a committee or task force within the structure of a society. And this is a big ask. It'll take some time, and it certainly takes bringing together a group of people to do it. But this is the other thing we've noticed, is that societies need something within their governance structure to really move forward on climate, and a committee or a task force is often essential to doing that kind of work. Next slide, please. So if you'd like to learn more skills on how to advocate for institutional change, I welcome you to join us. You can join our listserv. And then I also just wanted to plug, we unfortunately are at capacity for our in-person attendance for our large convention, of which the National Academy of Medicine is one of the core planners. But we will have full virtual offerings as well. And we are covering all of it, everything we think you need to know for the next few years to be an effective communicator, researcher, educator in the field of climate and health. And I will now turn it over to Paige.
Thanks so much, Lisa. So I want to talk about growing your passion. So thank you to Lisa and Gary for really these big overviews. I want to talk about how you as an individual can engage if you feel like this is, I need to get started on, but you're not sure how. Next slide. So I just want to talk about first, just starting the conversation. I think this is where we can begin, and this is where resources in Healthcare Without Harm's website and the Medical Consortium website can really help you. Please click forward. You will see that you can really start to learn about the impact of the sustainability movement on healthcare and some of the specifics. You can just start by noticing wasteful practices around you and talking to colleagues about them. Like, why do we do that? Why do we use this item for 1 second and throw it out? Or why do we open that item and not use it at all and have it go in the trash? This plastics thing is around all of us, and we can look and just notice ways and talk with colleagues. And I think that will be something that you will start to grow your community, because you will have some people that say, I worry about that all the time too. I'm always thinking about that. And that's how you find those like-minded colleagues that Lisa was talking about. Help people find more sustainable solutions to everyday challenges. This is one where you're really looking at a solution with someone else. They have a problem and they have a solution, and you're really offering up what that secondary idea is for how we can solve this in a more sustainable way. And then point out changes, small changes that have big impacts. This is where Clean Med often has a section on this, but this is where high value care comes in. You can point out that not ordering a test has a roller coaster effect of savings from an environmental standpoint and from a money standpoint. And as I said, you really need to know your facts on this. When you're going to be talking about it, you want to engage people in what the facts are. We'll find those like-minded colleagues by doing all of the above things. And then I think most importantly, you want to begin with a small project that you can control. As Lisa said, you want really big ideas because you want to sell people on your big ideas, but then you want to have those stepping stones. How am I going to get to that really big idea? I was part of the group with Lisa at the very beginning. They were thinking about reusable gowns around the Stanford hospital. And I was like, we can do reusable gowns in the operating room. And so, each person can think about their own specialty and say, how can I be the leader of change in my own spectrum? And then I think what's really, really important for sustainability work is that you need to share your results. Get up on the stage at Clean Med, get up on the stage at your own local medical society. Tell them what you did, step by step, tell them how you did it. Hand out a one-pager of this is how you can do it. Do this at the local, regional, or national level, wherever you feel comfortable. And then let's publish our results. People need to know that sustainability science is a real science and that we are diving into the details of it. We are looking at the impacts from cradle to grave, and we're really figuring out how we can make a change. Next. So going through sustainability research, sometimes it's hard to engage others on this. And so I really urge you to think about quality. Think about some of the sustainability changes that we're making as making a change in the quality of the care for the patient. Every hospital can get on board. You can see some of the societies here that support quality work. And so this can help you get your research funded too. So really start with the lens of quality. How can I use this change that will decrease plastic, decrease wasteful tests, decrease hospital admissions, length of stay, save my hospital, as Gary showed, millions of dollars over time, if I think about this from a quality standpoint. Next. This is aligning your efforts with the hospital interest. Every hospital wants to see their name on the top quality rung. They want to save money. These are two things that are inherent to the practice of medicine. And so sustainability can work hand in hand with this. Next. I also want to tell you that you're going to hear some no's. I remember hearing a lot of no's. I started this work in 2018, and I heard, no, I can't help you more times than I can count. And when I finally got to thinking about reusable gowns in the operating room, it was January of 2020. And within 3 months, the idea of that project was completely gone because we were in the pandemic and we didn't have gowns to talk about anymore. And so while many people said no, it doesn't really mean no. It just means that project doesn't work for us right now. And now in my role as a medical director, I have to say that to other clinicians. Your idea is great, but that doesn't work right now. And that's because we really have to align with what the hospital wants and where there is money. And so my last point here is strive for green. So I believe that all green changes in sustainability are most successful if they are green, meaning they save some money. Now you can make a trade-off here. You can say we're going to increase money spending on this because we're picking this more sustainable product, but over time, we're not going to have to buy so many of those products. A great example of this is our reusable and reprocessable devices. You've got to spend some upfront money, but you can show the savings in the future. But you've got to make that financial case as you go to your hospital and talk about why clinicians can lead this charge, is because, as was mentioned earlier, we have some control over the purchasing processes. Next slide. So for us at Stanford Healthcare, we've come up with these 5 pillars that guide all the decisions. So as you're thinking about a sustainability idea, you look at this list and you say, how does my sustainability idea fall into one of these or multiple of these 5 pillars? And then I write and frame my idea before I go to those leaders that Lisa mentioned, before I go to, my chief quality officer, before I go to the chair of my department or division. I want to think about, how am I aligning with the hospital's mission? And that way I'm likely to get way more buy-in. Next slide. In closing, I just want to say, please reach out. Lisa was certainly on the forefront at Stanford. It took a lot of like-minded colleagues saying we need a physician for Stanford to create a medical director of sustainability. I've been in this role for a year now, so I'm certainly still learning, but there is definitely a transition when you are able to get up with hospital leadership and promote other clinicians' ideas. Thank you.
Thank you all so much. That was super interesting. And I love the different perspectives that you all take from your different roles, yet all were actionable and creative and potent. So I do want to ask one question first amongst us to back us out. And this was something that Gary hinted at, and that is to acknowledge basically that we're having a major change in our federal government. And so it's too early to really know what all will happen over these next 4 years, but the first 2 weeks have been a little bit shocking. And so my question is really about, just to keep this narrow with clinicians, are you getting a sense from who you've been talking with that this is the kind of pressure that is worrisome to them, that is scary to them, that would prevent them from speaking out about this? If that's the case in any way, what advice do you have for engaging clinicians, particularly of all disciplines, to not abandon our commitment as healthcare professionals to the health and well-being of all people? Any thoughts on that today?
Yeah, I'm happy to start. We're in California, so I think we're lucky in a way because our institutions have certainly said, we're not backing down, like this is our work and this is what we're going to do. But within the consortium, we also work in states where it's a very different political context. And so part of this is going to be figuring out the language that works and aligning the values and the way that you can move forward, because it's undeniable that healthcare facilities are being impacted by these worsening weather disasters. It's undeniable that, and there's broad bipartisan support for things like not polluting our land and not polluting our air and not polluting our bodies. So some of this is just going to have to shift in terms of messaging. I do think with the void in federal leadership, we will be back to where we were in 2020 where healthcare institutions need to step up to continue being leaders, because we're not going to have that leadership there. But I would say even in politically challenging contexts, I've talked to a number of conservative CEOs in conservative areas. What we can all agree on is that people want clean air, and we can all agree on cost savings. And then the third point is, and I think this is a point that Gary raised, is that what we're seeing there's a mix between burnout, physician burnout, and when hospital facilities take on sustainability, what it means for morale. And so taking on that kind of stewardship, and that stewardship is a word as well that crosses political aisles, is something that really infuses people with a sense of moral purpose, particularly those of us that went in to serve and take care of others.
Thanks, Lisa. Other comments?
I would say, just echoing what Lisa said, it depends on where you are, what you say a little bit. So you may be in one part of the country and you're not going to talk about fossil fuels because you know that is an unchangeable. They're committed to fossil fuels. It's part of their economy. That is not going to be the place where you're going to talk about fossil fuel reduction. But some of these things that we're doing just make good sense across the board. And so as we talk about increasing the quality of care through appropriate use of supplies, that crosses all borders, because I think across the board, everybody says we're spending too much on healthcare. So anytime you're making a monetarily smart decision that's also a sustainable solution, I think those things go hand in hand and really can continue driving us forward for as long as we lack a political leader.
Thanks.
Yeah, I mean, I would add just that, I think that in this current regime over the next 4 years, environmental leaders and activists are going to be targeted, and there will be efforts to criminalize dissent. So even more important are that healthcare leaders are able to be the messengers for the truth of what's happening in people's lives. And the more that we can talk about the health impacts that people are facing around the country and around the world related to pollution, the more that message will break through, because whether you're in a red state or a blue state, when a hurricane comes through there, or it's 100 degrees for 3 weeks and you're an older person, you can't get out of your house, or you've got pre-existing asthma, doesn't matter what political party you are. So the reality of the fact that the climate crisis is accelerating in an exponential way, and creating the cognitive dissonance between the felt experience of people and the political pronunciations coming out of Washington will be important.
Yeah, you really touched on two important things. One, that health is an important message, and that healthcare professionals are important messengers, and how to help keep that voice loud and clear, louder and clearer, I would say. Let me just push a little bit more on that. And Lisa, this would refer, I think, to your work in part, because you work so much with, did you say 60 different consortiums across the nation, and working with them to try to activate, it sounds a little bit like. Do you have advice for language, motivation, engagement strategies to help really do that important work, which, as Gary points out, is crucial right now?
Stories. We're emotional creatures first and rational creatures second, third, or fourth. But I mean, what we've learned over time, right, is that it is our stories of how we're being impacted clinically. It is our stories of how our patients are being impacted that open the door to people hearing us on what else we need to do. I had a conversation with Representative Adam Gozar. He's from Arizona, a MAGA Republican, wants to entirely tear down the EPA. And we talked about, we talked about air pollution and its effects on the fetus and on a pregnant individual. And he didn't know, for example, sorry, it wasn't him, it was a staffer. We were able to align on a shared value that no person, no child deserves to be born pre-polluted. And so I would say it is our stories, it is our shared values that can help move leadership to want to take action. And then also back it up with the data. Oh my gosh, every day there is more and more literature coming out about the impacts of fossil fuel pollution, the impacts of climate change on populations. And so have your clinical stories ready and then show what the literature is showing in terms of how it's impacting our clinical care and how we need to prepare people for it. Just one last little anecdote. Emily Oster, she's the epidemiologist at Brown. She had a physician on from MGH who is not a pediatrician, is not climate changed, and provided false information on Instagram Live. And to me, what that showed, I'm going to actually use that clip when I'm talking to medical societies to say, hey, this is what's happening if we don't provide this education ourselves.
Yeah. Great reminder that the facts are still the facts and the evidence is important. I want to ask a question from the chat. And Gary, I'm not sure if this might be something you could help with in terms of the HHS pledge. So the question is about, so the HHS pledge, some of you know about climate and health. It was asking health systems to make a commitment to reduce scope 1 and 2 greenhouse gas emissions in half by 2030 and set a net zero goal by 2050. So what might happen to that going forward?
Well, from the point of view of the federal government, they're going to eliminate it. They're going to eliminate the office, or they have already, of climate change and health equity. Much of the information and reports that are on the Health and Human Services website have been taken down, and Health Care Decarbonization and others have actually captured that information to memorialize it and have it be available for hospitals to move forward. There's been about 1,000 hospitals who have taken that pledge. And then there's been the Veterans Administration hospitals and the military hospitals that were under mandate to do so. So all in all, there's probably 1/3 of all the hospitals in the United States through various voluntary, mandatory state level requirements that are actually now measuring their greenhouse gas emissions. So it's a huge number. So, a couple of things I would encourage. I mean, at Healthcare with Harm Practice Green Health, we're going to continue to support those hospitals that have taken that pledge and help them on that path. I know the National Academy of Medicine has got a series of webinars in that regard. I know that the Medical Society Consortium is partnering with us to actually create more momentum, leveraging clinicians to get other hospitals to take that pledge. So in the absence of any kind of federal presence or leadership, and in fact, denigrating work on this issue, it's up to NGOs, private sector momentum to continue that forward. And the good news is that this isn't just happening in the United States, it's happening all over the world. There are 90 countries now that are part of an initiative at the World Health Organization to build low carbon, climate resilient healthcare systems. So we have a tough road to hoe over the next 4 years in this country, but the momentum will continue. And the last thing I'll say is that what Paige said is really important, is that in innovation that happens in one corner of the country, let's say at Stanford, because there's a broad network now of hospitals and health professionals that are all traveling down and building inside of this movement, innovations that happen in one place can be shared in other places, and then it can be implemented exponentially quicker than in the past, which is why I said it's really important to not be alone. You need to be with others.
And luckily, there are a lot of people working on it, which is a great relief, basically. Say, I have a question for you, Paige, reflecting your comments about quality that really ring true to me. And this is from an attendee, and their comment is a little bit like, this is my interpretation. Does it look bad if we say we're cost cutting or reducing waste? Does that compromise the quality of care? Does it look like it compromises the quality of care? Is there a balance there, or is that a matter of messaging? What would you say about that?
I think this is why it's important to do these changes as a study, so that you are really telling people, I'm going to make sure the quality is the same or better when I'm making this change. Some of the changes I think are a little bit easier. A great example is a surgical pack. You look at a surgical pack, we've done this And then we watched surgeons operate and we said, 45% of the things that got opened were not used at all. This is not going to change quality care. It's just, how did these things get in the pack in the first place? And you're just taking out what's not being used. So it doesn't change quality. So I think it's important, as you said, the messaging. We've just removed unused items. That's an easy one. But when we make changes, I think it is important to back it up with follow-up. Say, I'm going to change from a reusable to a reprocessable for this procedure, and then follow up what happens so that people feel comfortable with that. And that is how, to Gary's point, that's how we can amplify our effects, because then we wanted to use, great example, we wanted to use reusable anesthesia circuits. We said, you know what? They're using them at Children's Hospital of Philadelphia. Let's see what their experience has been. And by comparing across institutions, my institution says, oh, we know they do good stuff. We're going to follow along. And so that's so important that we share that knowledge across borders. And that helps, I think, allay those concerns. I never call it cost cutting. I think it's cost savings, and it's increasing quality by reducing waste.
I don't know if you've experienced this. We have in Providence that people, the employees and caregivers, aren't that enthused about saving money. They don't care that much about it. But when we're able to translate it to pounds of waste, metric tons of CO2, et cetera, that we've reduced, they get quite enthused. It is the same work. I agree with you. And I like to think it does enhance quality. It may not be exactly clinical outcomes, but it's the whole practice of how we're delivering care. Have you come across that feeling too? That sentiment?
Exactly. You know what? I think we take our impact and we look at it in multiple different ways, because we don't know what is meaningful to each of our employees, colleagues. We know the money appeals to the hospital system, but we looked at the impact of a telephone clinic and translated that into decreased miles driven. We translated it into trees planted. We translated it into all different things, figuring what appeals to different people. And when people walked away from it, some people were like, 2 trees per clinic visit, they were so excited by, that reduction, and they were talking about trees. So exactly, they didn't care about the gas money. They cared about something different. And so to your point, we need to translate it lots of ways, because honestly, metric CO2 tons of greenhouse gases to those of us on this meeting may mean something, but that means very little to the average American.
Super. All right, we are almost out of time, and I do want to visit a question that came in that we probably all have feelings about. And it is the practical work in healthcare systems of getting this done. So the importance of staff that you talked about, Gary, of clinical staff that we all represent. What are your thoughts, advice about this? What are min specs? How is it justified? How crucial is it to actually get this work done? And anybody who would like to go, please go for it.
Well, we found that having somebody whose kind of job it is to do this is going to make it a lot more possible, actually as a quarterback. And then having green teams of different specialties come together from different parts of the facility, it just creates the yeast and the power of collective action and people coming from different perspectives. So the sort of best recipes for success, what we've seen in the hospital setting, is if the leadership embraces it, as the leadership at Stanford has, and then there's people devoted to it as part of their paid job to then move some of these agendas forward, because some of them save lots of money right away. Some of them are a little more long-term, but you need the infrastructure and the support systems in place to be successful.
Lisa or Paige, yeah, go.
I think we're going to get hung up on the small projects if we don't have the oversight. So we can do the small projects, they're executable without sort of the oversight. But the big projects that Lisa's talking about, the sort of really institutional sized efforts, they really take leadership and someone's full-time job. And that circles back, I think, Beth, to what we just talked about, where we do have to mention the money to this group, because we're going to take this money that we're saving and here's where we're going to use it. We're going to use it for this person's job, their FTE, their whatever, so that we can do more more projects and save more money. So that's where I think the money is really important, is in furthering this work.
Thanks, Paige. Lisa, anything to add?
I just want to plus one the fact that you can only get so far with volunteer efforts. You need infrastructure, whether we're talking about medical societies or whether we're talking about healthcare institutions. You need the infrastructure to achieve on a mission.
Further, it's becoming more and more technical and regulatory and reporting required. So it's not something you can get volunteers to do necessarily. You really need expertise. It is a science. Thank you all so much. I'd like to continue this conversation. I think it's been great. And thank you all for joining today and for the NOMS Clinicians Leading Environmental Sustainability Transformation webinar. Resources shared during this webinar will be posted shortly. You can reach out to the email address there that you see if you have questions. And please watch for the next in the series that'll be coming out in a little while. And thank you all again so much for joining.